What subtle early dementia signs do doctors sometimes miss? Imagine trying to spot a tiny change in a busy picture. Early signs of dementia can be just as small and easy to overlook. These signs often blend into normal aging or other health issues, making them tricky to recognize. Doctors might miss them because they don't cause major problems at first or because the symptoms are vague and develop slowly over time. One common early sign is subtle short-term memory changes. People might forget recent conversations, misplace keys or glasses, or forget why they entered a room. These lapses are more noticeable than normal forgetfulness but might not seem urgent enough to worry about. Because they are mild, they can easily be brushed off as just aging. Language difficulties are another subtle sign. Someone may struggle to find the right words, pause mid-sentence, or substitute incorrect words without realizing it. These language issues can be mistaken for normal forgetfulness or occasional slips, especially if they happen infrequently. Mood and personality changes can also be early clues. A person might become more anxious, irritable, or withdrawn. They might seem less interested in hobbies or social activities they once enjoyed. These emotional shifts are often attributed to stress, depression, or aging, which can hide the underlying cognitive changes. Difficulty with planning or problem-solving is another subtle sign. Managing finances, following a recipe, or keeping track of appointments can become harder. These challenges might be seen as carelessness, fatigue, or distraction rather than signs of early dementia. Reduced concentration and confusion are also common early indicators. Someone might find it hard to focus on tasks, lose track of time, or get confused about where they are. These episodes can be sporadic and easily dismissed as tiredness or stress. Behavioral and awareness changes can be very subtle too. A person might show less empathy, have a changed sense of humor, or act differently in social situations. These shifts are often mistaken for personality quirks or mood swings, especially if they happen gradually. Doctors may miss these early signs because they often overlap with other conditions like depression, anxiety, or medication effects. Patients or family members might not report these symptoms, thinking they are just part of aging or stress. Since early symptoms don't usually interfere significantly with daily life, they might not trigger concern or thorough testing. Recognizing these tiny clues early is important. When caught early, there is a better chance to plan for care, manage symptoms, and possibly slow progression. Healthcare providers use detailed assessments, including cognitive tests and input from loved ones, to spot these subtle changes. In summary, early signs that doctors sometimes overlook include mild short-term memory issues, language problems, mood and personality shifts, trouble with planning and tasks, concentration difficulties, and behavioral changes. Being aware of these signs and seeking regular checkups can help catch dementia early. Remember, everyone's experience is different, so if you notice anything unusual, it's always best to consult a healthcare professional for personalized advice.